All right, we are recording. So everyone is aware, if you are on and your camera is on and you speak at this point, and we'll announce this at every slide, you're consenting to be on a video recording of this event. We're gonna start putting these on YouTube. So if you're not comfortable with that, please don't turn on your camera and don't speak, because we won't be liking to want to edit these in the future. So if you do that, you are consenting to us putting this recording online. Let's get started. Go ahead, Ed.
And so on the following slides, there is like a little disclaimer at the bottom. I don't know why on the first slide I wouldn't have put it on there, but I didn't. So, but it does say that it's being recorded for the other slides moving forward. Something we also wanted to point out that although this process is obviously so intertwined with FTF, we're not representing FTF in any way. So this is us hanging out from our Facebook group, and that's who we are, and what we're going to be talking about is shaping within skill-based treatment. But again, we're not, this presentation is not associated with FTF. That's the second order of business. Third order of business is my name is Ed Sidley. I am a frequent hanger-outer for these. I really enjoy them a lot. I'm excited to be doing shaping with you today, and I'm participating with Hillary and with Shane. Do you guys want to say anything too?
Sure, I'm Hillary. I feel like you know who I am from the group. I'm in there all the time. One more disclaimer really quick is that we're going to put chats in the chat box, and if something comes up in the chat that you want to, we'll go ahead and try to answer those as we go, but we're going to try to hold Q&A for the end in order to process the recording, so we'll kind of cut it off if we need to before Q&As. So there's that. Yeah, I'm really excited to be here. I love doing these too. I really appreciate Ed's graphics, so that's like a big part of my SR in doing these and seeing what he puts together. So yeah, Shane.
Hi, I'm Shane. No disclaimers for me. I love the graphics as well, and I also love shaping. And I think Dr. Megan Miller is here. I feel like in my practice when I was in school, I didn't learn too much about shaping, and she was one of her podcasts or something on the Do Better movement. I was like, whoa, I need to dive more into this. So shout out.
Shout out to Megan.
Awesome. All right, so let's get started then, right? What do you guys think?
Yeah.
Let's see. Oh, you're controlling Hillary.
Oh, right. I have so many windows open. I don't know how to do this. There we go.
I know the feeling. Okay, so yesterday, the three of us met to kind of go over the little, pre-Zoom, and we ended up, I think, like hanging around this and the next slide for almost 45 minutes, and we realized that, like, I guess we had enough to talk about just in these first couple. But anyone who's seen my previous slides or previous hangouts knows that, like, I usually include something about the must-haves at the very beginning, because I think it's really important for newcomers or more experienced practitioners to always keep this in mind and keep this in the forefront. So that's like on a daily basis when you're prepping for either analysis or treatment, and that could be when you're just starting off, or it could be when you're midway through treatment. Every single session, every single trial, you should have this stuff in your mind. So I talked about that before in previous hangouts, but I think what was interesting yesterday is when we were talking, we had discussion went a little bit more in depth that I hadn't considered too much when I was making the slides initially, which is, I think that's pretty obvious that the things that are on here, you would think like that makes sense. Like you would want those when you're working with a learner. But something that I know I found in my experience that, just that I've seen is that it's not always as easy to have clear-cut answers of whether or not you have all of these or just some of them, or, I think that it's pretty self-explanatory. You want everything to be safe. But what if the HRE is not necessarily safe for the practitioner or for the learner? What if in my experience, I've had a lot of times that the HRE is maybe fleeting. So like, one day you got it and the next day you don't. So, that kind of always keeps it fresh in your mind when you're really trying to make sure you have it. But, sometimes, you ask questions, is it televisable? And then who is it televisable to? Like, who are we questioning whether it's okay for them to see? The idea of being on the evening news. Yes, like these are all things to consider, but I think that when I first made this slide for, I believe it was the Learn While Teaching one in August, I thought that these were like an automatic, like no-brainer kind of thing, and that like, oh, you just have to always keep these in mind. But I just found more and more, and also questions on the group, that it's not always so clear-cut and easy. So what do you guys think, Hillary and Shane?
Yeah, totally. I think our discussion centered around, I think that who is it televisable for, right? I think that's a big thing that comes up a lot in the group, especially when we're thinking about reinforcers that maybe aren't super televisable. So for example, our discussion yesterday kind of centered around learners who are maybe reinforced by reprimands and negative attention, and that might not be super televisable, but you may find that you need to include it in your analysis and treatment initially until you can shape it out. So I think the idea behind these is so beautiful and so important, but we also know that we do have to take departures sometimes from where we're at in order to get where we need to be, which is meaningful outcomes. Sometimes in these early days, we need to make some departures. And we're going to talk about that a little bit in one of our analogy slides, which is if you don't have the hottest SR condition, if you don't have the best motivational distance, you might not be able to get to the most meaningful outcomes. And so in order to get that distance, you might have to include some things that divert a little bit from these must-haves. However, in theory, they are still in line with the must-haves, right? They might not look like it from an outsider. They might not be televisable on the evening news, but in theory and in practice, they probably do align and just need a little bit more discussion in order for someone to understand why. Shane, do you have anything?
Yeah, and to add on that, you need these must-haves, but I think context matters, right? The televisability thing where it's like, why is this kid have its iPad on a trampoline with just because I just saw Megan pop up here with paper being thrown on them and things like that. Like, how is this televisable, or is this too much? And I think that's why the context matter. We're trying to make that Disney World effect, which I think sometimes people get in their mind, that's not the real world, or that's not this, that's not that. But for that learner and for that person, it's very important. And also just with the HR, with the safety televisability, what I've used to run into more, not so much anymore, but it's not what we think the HRE should be. It's really what that learner's HRE is. Because sometimes we're like, well, I think the iPad should only be an HRE for 10 minutes because like that will do this. Or I think if I add those 5 toys, it will look odd. But I think we need to obviously take a step back and say, nope, this makes this learner happy, and it's actually going to teach this learner more skills.
And we don't get to decide what people like to work, right? That's not our job. So I think that's really an important perspective when we're thinking about televisability is, we have to think about what that learner needs, and we can't decide if they like lining toys up. I mean, I think this really speaks to an underlying discussion in our field right now, which is, a lot of people are having some problems with what ABA is trying to do. And one of those things is trying to change learners' interests, right? They're too old to like Spider-Man, or they shouldn't be lining up their toys. And I think what I love about this process is we strip all that away and we just say, what is it that makes you happy? And we're going to embrace it and support it to the best of our abilities. And that's such a beautiful thing.
Awesome.
Alicia says a reinforcer is what it wants to be. Love it.
That's awesome.
All right.
Well, before we jumped, I just had another thought too, and that goes back to the safety part of it, which is it's a random little anecdote, but that I remember we were talking about a student who liked to climb things, right? So for us, like in the school, you'd say like, oh, safety, like you're not supposed to, they can't be doing that in case they fall. And I remember Dr. Hannah saying like, usually kids who like to climb a lot of things are really good at not falling. And like that kind of like opened up my eyes in that sense too, of like, you know what, like why block him right now? And this is something that actually perhaps would lead to probably, this is something that he had a hard time with, he's very sensitive to, why don't we work on allowing him to go on that, then telling him he has to come down from it and then working on communication from there, as opposed to just saying, nope, it's not safe for in a school. Now it also came back to bite a little bit down the road when he wanted to stack desks on top of one another to hang from a 10-foot basketball hoop. That was too unsafe. I'm sure he probably was really good at not falling, but in that case, we wouldn't be allowed to do that. But the point was still made. Okay.
Yeah, and it's probably more safe than the alternative, which would have, if you're thinking about a student like that who's likely going to be using SBT, would likely result in forms of severe problem behavior, which is even more unsafe to them and to other people. So
Yes.
it's a good frame.
Yeah, and just to add one more thing onto that with the HRE, I think skill-based treatment, the main thing you're working on meaningful skills. What's meaningful usually to the client and to the family to have those outcomes. And I had a kiddo who loves the iPad, loves dinos, but also loves to run, and that can be very problematic for some people, especially like, oh, let's go outside and do this. There could be a car, there could be this, there could be that, but that's today we're talking about shaping. For me to ignore that meaningful thing that kiddo wants is to learn to like run outside in a safe manner. I wouldn't be being a behavior analyst anymore. So I think it's really looking at their HRE and being like, well, these are things that are important and meaningful to them, and usually will become meaningful to the family, or is meaningful to the family.
Alicia has an amazing comment that I want to expand on. The answer is always both. Both give them access to their HRE playing the way they want to play and work on expanding their interests when it's our way. And I feel like in its essence, that is shaping, right? We can do HRE their way, and then in our cabs, we can teach them better ways that are going to be more valuable if it is like a dangerous or maybe something that we need to teach them to do in a different way. And we can do that during our cabs. I just think that's a beautiful way, like Penny says, to create some balance between their wants and needs and our wants and needs. So let's jump into shaping.
Hmm. Okay. So this little slide was made after. Yes.
Sorry, every screen. The Zoom is being recorded. If you're staying in your videos on, you're consenting to being recorded.
Is it too low?
I'm just saying it again. I'm just
I know,
being
but
overcautious.
can you? I can't see it, the thing on my screen.
Oh, I can see it.
Oh, okay. Well, yes, this is being recorded, everyone. So this came about from a comment that Logan had made, and unfortunately he is not here today. He actually had to work, but he pre-recorded a little clip for us to discuss this a little bit more, and then we're going to talk a little bit about it. But basically he referred to an analogy that he had heard about how generalization occurs much easier if you're working with the hottest EOs, right? And if you're treating the student with the highest reinforcer matching the hottest EO, and basically how that's going to help generalize to other people after you go through the shaping process. So let me play this, and then we can talk about it after. I can't screen share, Hillary.
Yeah, I'll give you back power. You're gonna lose my screen share, and it'll be yours now.
Okay. Okay.
Don't forget to share sound.
I did forget, but now I'm going back. Okay.
Hey guys, my name is Logan Wagner. As you can see, my face is right here. Thank you, Ed, for the awesome visual. So sorry I can't be there today when you're going to be watching this. I'm actually with a client, so I decided to pre-record this so that I can have an opportunity to chat about the mountain analogy. So today's theme is talking about shaping within the SBT process. So Ed reached out to me because of a comment I made a while ago on the Facebook group about making sure that we're teaching from the most reliable, hottest evocative condition that's like reliable and convenient, so that we can basically try to teach towards this top of the mountain. And when we do that, it is more likely to generalize down the mountain to other less evocative conditions. There's a lot to this, however. It's just not a blanketed statement on, hey, always just start off with the hottest evocative situation, because then you'll have the best chance to generalize. As always, it depends. So this is where we want to be. We want to work there. All right. So Ed had an awesome annotation here where he's saying, don't just go ahead and try to teach these in natural contexts or contexts, because it's basically just like trying to push a boulder uphill. It's very difficult to do. The client's already upset. There's not a ton of ability to teach from a place of joy. So we're really wanting to adhere to those core values of teaching from safety, with dignity, and by building rapport. So what we can do is we can try to isolate and be able to replicate those hottest evocative conditions and teach from there. So like what I was saying, it's basically, if we can get that skill down pat in the hardest situations, then if a less harder situation comes along, the learner is more likely to be able to use the skills that they've already learned. So how do we get to the top of the mountain? Here we see that if we have an awesome SR condition, it kind of makes everything easy. We have that, it's worth it. Like, let's go ahead and do some of this hard work, get that motivational distance, so that when we get back here, it's worth it. It's Disneyland. It's something that like we want to be in, rather than if we're just kind of here in like blah land and we ask them to go to the top of the mountain, they're not getting that distance. They're not moving back to a place that's worth it for them. And most likely we're going to end up in environmental or emotional wasteland, in which we're not in a place that's safe. We're not in a place that's super dignified, and we're definitely not building a rapport. So if you haven't read this article, I posted about it a little bit ago, the Shaping Complex Functional Communication Responses in 2018. So this is obviously talking about shaping, and shaping has to do with behavior, the client's behavior. So you're like, why is EO being talked about? Well, it's not changing up the EO isn't necessarily shaping a behavior, but it's allowing us to be more effective shapers. So here they give examples on how they made it so that it wasn't as evocative of a situation. It was still evocative. They still had a behavior occur, and they made it easy. They said, "My way, please." And then they made it basically the same, and they taught, "May I have my way, please," with a calm voice. All right, and then they made it harder, a more evocative event. They're moving closer to the top of that mountain, and they're expecting a little bit more of a little bit more of the end result that we want. We're shaping towards that end behavior that we're trying. And then they're making it hardest situation. So this is the top of the mountain in this scenario, and they're expecting exactly what they want. This is the end result going on. So they are slowly, methodically isolating and replicating, being efficient with their EO conditions so that they're not getting to emotional wasteland. They're making it so that the learner is able to handle it while turning up the heat. And at the end, they're here. That's beautiful. And what they do is that they made sure that they had that place, that SR condition well figured out, so that HRE could be produced. That's the result of the SR condition, so that the client's loving it. The learner is there for it. All right. So that's kind of teaching the FCR, the very beginning of it. We can try to make it so that our EO is the brightest, and that our beginning of the chain is starting to be there, or is starting to be super strong as well. So this also kind of works towards our cabs, right? Because with our cab 3, cab 4, cab 5, we're also methodically climbing up this mountain, using the SR lift. Again, we're teaching from a place of joy, and we're getting towards this cab 6 where it's challenging, it's difficult. This is where we're landing with our cabs, where we want to make sure that our learner, when they're done with this process, that they can handle anything. So it's just being able to shape their behavior and being very methodical and very intelligent with design your EO conditions to make it so that it matches, right? So that it's difficult enough and that we're expecting enough for their behavior, and it goes up, and it's always worth it for them. They always know throughout the whole time that they can trust the process, because they can always go back to that SR condition and in the land of HRE. If there's all these little fires that happen in the mountain, like our unplanned EOs, where something, setting events that we're not really aware of, bad night's sleep, stomach ache, all of a sudden it's just too hot to handle, like something you did something a little bit different, or for some reason they just can't handle it that time, it's okay. You just can try to go down a little bit with the mountain a little bit, shape back up the behavior and work back up that mountain, making sure that you try to avoid these little fires. And our object is to always be at the top of that mountain so that we can plan on those skills to generalize. Sorry if I'm ranting now. I'll go ahead and get off of the video. And I know that the rest of the presenters will have a lot more great stuff to say if you guys have any questions. Thank you so much. Bye.
So thank you, Logan, right? That was really, really cool. Hold on, let's see. Hillary, I'm going to make you host again. Okay. So I would say props to Logan, because aside from him taking the time to do that, I think it's always hard to sit and like record yourself doing something. So I give him definitely a lot of respect for that. And I also was thinking about it as he was talking the first time I watched it, that like I gave him this like graphic that I made, and then we never talked about it. So he was able to like, you know, kind of get into my mind a little bit and figure out what I was kind of, you know, drawing on this canvas. And interesting, like I actually had like a slightly different idea of what going up and down the mountain was, but it's still, they both work together. We were talking like this a little bit yesterday. So just to jump right in, what I was kind of picturing as far as the SR lift was, you know, getting to the strongest points of HRE so we can treat the strongest EOs for problem behavior during treatment, right? So that's what we're going to be identifying. Pushing the boulder uphill to me is the idea that, you know, the triggers or the eggshells that people walk on, they don't say certain things. They don't even, it's like walking on eggshells, right? So if you're trying to teach with half the SR and you're not really addressing the strongest causes of the problem behavior, then there's no surprise when you see time and time again, like year after year, a student still engaging in the same types of problem behavior, because you're not really addressing what is like the cause of it, and you're not doing that because it's not safe, right? So the too hot to handle triggers, I'm thinking to myself, just students I've worked with, you know, you can't say certain things, like, you know, Dr. Hanley had talked about when we first saw his presentation a few years ago, the rules, like, you know, like you walk into a classroom and the teacher says, oh, you can't say this, this, and this about a student. Like we had several of those students, and one of them, it was, you couldn't even say certain words to other students in the classroom or other staff. And, you know, if the student heard it, you know, it would be R2 going into R1 behaviors, depending on how it was responded to. So, you know, that just, to me, in that example right there, to me, that's, if you're not addressing those trigger words and you're trying to use, you know, basically arbitrary reinforcement to, you know, teach them skills, you're doing that halfway up the mountain. You're not getting at like what they really, really need. So, you know, what we plan to do in treatment, now it doesn't mean like the first day of treatment, you're going to start saying those trigger words and say, you know, well, we're working on this now. You work on that deliberately, and you maybe progress to it. Maybe it's a CAB 6 challenge, you know, but the goal is that during treatment, you're going to be saying those words. You're going to be doing those things that are giving them a hard time. And so then that's what's going to be happening at the fire at the top. You're not going to be dealing with as many unplanned DOs. You're not going to be planning You're not going to be dealing for the too hot to handle triggers because you're going to be only presenting them when you think that they're going to be ready to handle them. But you are going to be giving them, you know, those EOs. So, and that only happens then when you have that trust and rapport. So you kind of, the SR lift, you know, lifts you up over that bad side of the mountains, forget the boulder. And then once you're able to work at the top right there and you're able to work where the front fire is burning brightest, that's the idea of then like generalization is easy. You know, we were talking about it yesterday. You know, that first time a student goes through the process with, you know, 1 or 2 or 3 staff members, whatever it is in that context for them, you know, when you start to generalize to other people, it's amazing how much quicker it goes with other people, right? That's like the opposite of how it was, you know, in other situations prior to skill-based treatment. So it's just been amazing. And like from our experience, I can tell you that people jumping in to work with these students, you know, if say it took like a month or 2 months for them to get through CAB 6, you know, maybe they do that in 5 days. You know, that's just an example. So do you guys want to add anything to that?
Yeah, my thought is, you know, here we are asking you all to come to a presentation about shaping, and we haven't really talked about shaping. So why have we talked about these 2 slides first? I think it's just the framing of these 2 slides is so important, because without them, we don't have what we need to shape. So I wrote down a couple notes as I was listening to Shane and Ed, so I'm just going to kind of speak to them. We have to have the motivational distance to do this, and without it, we will run out of steam. So that's really what that's really what we're looking to get with our really solid HRE and SR condition, is to have the motivational distance to be able to do the hard things. And what I have found with some of my clients is that maybe we can't do that right away. Maybe we have to start halfway up the mountain and shape some of the things in SR that we can't do yet out, and then come back to it later, right? And then go up to the top of the mountain. So we might not be able to start our treatment where we're going to generalize to. We might have to start lower and increase over time, because we won't have the motivational distance for where the fire is the hottest. But when it comes to like why we need this fire, why we need this HRE condition when we're shaping, it really provides us safety, because what we're going to do is we're going to, you know, when we're shaping, we are all probably going to hit a point, and maybe not, but with most of my cases, we hit a point where there's going to be a hard step, and we can shape the heck out of it, but at some point they have to do one of those shaping steps, and it's going to be hard, and we might have to push through a little bit of not severe, but minor problem behavior to get there. And having a good SR condition provides us the safety to be able to do that, to say, you know, do this one little thing. I know it's really hard. Just try it. I'm right here with you. And then we're done. And the SR condition turns it off, right? That's what our PFA tells us. And so it provides us the safety to be able to do some of the shaping that we're going to talk about. And I know from the group, a lot of people hit this point where they're like, you know, I can't get them to do this one thing. I can't. And it's like, I've broken it down. We're doing the smallest step possible. And so having this condition provides us the opportunity to get there. And that's the SR lift, right? We push a little bit, we're safe. We push a little bit, we're safe. I tell people when we start to feel comfortable, we need to be a little bit uncomfortable again. So this is really what we're trying to do, is on that lift, incrementally go up it while maintaining safety, because we have the best SR condition that we can possibly provide. And we can ask our students to do hard things and know that it's going to be okay.
Cool. And to add off that, now I'm just looking at a mountain. I was like, what's it take to get up a mountain? And then I'm thinking about my learners, where a lot of my learners, or just anybody in general, I would never say, hey, if the hottest EO maybe was climbing a mountain, I never say, let's get out there and climb that mountain, and you might be crying and moaning the whole entire time. We don't do that. So I think about with our learners, before you even climb the mountain, you shape up those early skills, which you might get some trust and rapport. Then once you get some trust and rapport, you move up that hill. You might start to go hit the trailhead. Like, I got your trust and rapport. I'm going to start up this trailhead. I probably wouldn't take them on the trail with the fire. So I'm taking the fire off. So I'm going to have my hose and say, hey, I'm going to try to take out all of these fires and really shape you up so you are able to climb up the mountain EO. So I think that's one of the important things that just hearing Hillary and Ed talk too, and just looking at this mountain, is that sometimes it is a mountain for our kiddos, for me to ask them, hey, we're gonna sit down and do 10 minutes of work. That might to them look like a mountain, but I'm not going to ask you until I have these early skills and that I trust myself that I'll be a good coach and can break those skills down for you.
Yeah. Penny's comment is perfect too. I always think of Megan Miller's podcast. Are we sure they have the skills for the hottest EO? And we'll find that, right? Like maybe we're told, here's the thing that is the hardest, right? This is what we want them to do. And we start this journey and we realize many of the component skills for them to be able to do this thing at the top of the mountain are not there. And so we can design our treatment around teaching those skills so that they are prepared for when we take that jump to the hardest thing, they're ready for it because we've taught the tolerance skills and the actual component skills necessary to do the hard thing.
Can I share
And when
something?
Sure, Meg.
I had a learner who would not use anything but her little training toilet potty for her entire life. And we had to break it down and shape it so much like that she was using it in the middle of the clinic, and we made like a bathroom out of towels around her. And just Friday, we finally got to the point where she could actually sit on the toilet and use it. And it took us like 2 months of micro shaping and going back and forth and like being able to tell her go sit on the potty and her saying no while she's like mid squat and being able to say, okay, we got you, go use your little tiny potty. So like every time I see all these things about shaping and hearing people like being frustrated and not knowing if they should be giving in to certain things, it's just a good lesson, I think, on how much we can really break down the shaping and learn how, let them know that they can trust us and we can get there at some point.
Yep,
that's it.
I totally agree. I mean, I think that's what shaping does, is it builds even more trust and rapport. Like SR is one thing, but then doing hard things together and helping your learner do those hard things builds so much trust.
Yeah. And even to piggyback off Megan's comment, that kiddo has to trust you to like, if that you're going to like to cover you up with a bunch of towel or to make that towel bare to be like, what are these people doing? Like that takes a lot of trust. And I even think about this mountain. I don't climb mountains with people I don't trust. Never, ever. And I think about that with like my learners. It's like probably not going to want to do much with me.
Oh, you're muted. Oh, okay. Yeah, I
he looks like a mountain climber, right?
Yeah, mountain climbing with people you don't trust. I don't think I'd do that either.
But he looks like a mountain climber, I think, Shane does.
Yeah. All right. So let's get into more shaping. Shane, this is yours.
Cool. Yeah. So materials needed. So shaping, first off, I hear some comments about Dr. Megan Miller. I know that podcast as well that Penny mentioned, and it's awesome if you haven't listened to it. So materials needed. So the reason I think I love shaping, and I wrote this down today, it allows RBT parents, BCBAs to deliver high rates of positive reinforcement that makes the world go round. So whenever I introduce shaping to staff or to parents, I actually feel like they're really into it because you get to spend a lot of quality time with your learner. So I think that is just quality time is awesome time. So HRE adds paint. So you need the synthesized reinforcement to be powerful enough to meet the challenges of the EO. So your HRE or SR, I sometimes run across sometimes that we only want to go like 25% into the HRE, but I promise you just get that paint out and go 100%. If your learner really needs an iPad with their blankets, 30 teddy bears, do it, because that is the paint they need for you to shape up to get up that EO, EO mountain. So really looking at that HRE. So I think some of the components you need to have an HRE are from your therapist. You need to be attentive, you need to be available, and you need to be authentic. I don't think an HRE is a physical property. An HRE to me is not a toy. It is not just this one thing. I think it's a transitive thing, especially how I look at it. I have some kiddos in the clinic that will do skill-based treatment for 4 to 5 hours. And it's sometimes the iPad now is not their HRE with us even commenting. It is now them moving, so us understanding motivating operation, them moving around and us following their lead to be like, now this is your HRE, and us being comfortable with that. and being able to shape our way back still and make those performance-based decisions on what you need. So always keep that in mind, that it's not just this physical object, here is your toy, you did this or whatever. It is a state that can move. And even think with us, sometimes my HRE might be me kicking back watching Netflix. Then I might want to go for a run for my new HRE, and that might get me in the state for me to climb my own EO mountain. So looking at that HRE, making sure it's quality is very important. So shaping as a brush, SBT is shaping. Sometimes you need shaping within the shaping. So I'm going to stand up. One of my favorite things to do is coach. So whenever my staff see me in my coaching stance, they know I mean business. And also I coach track and field here in New Mexico. So when I coach my athletes, I always get my coaching stance on. And I'm like, okay, we ready to go? What do we have here? And I think that stance to my learners and to my athletes really mean that I'm here for you. I'm going to put you in a successful position. But I use coaching analogy because I know Dr. Hanley talks about this a lot, that coaches sometimes are the best people to do this. You want to coach your learners. You just don't want to just be following the piece of paper. But and this, we're going to get into shaping, I swear. But putting your so shaping is, you're reinforcing approximations. So I would never put my one of my athletes that I know their baseline, or I know how fast they should be running. I've never said, hey, go run that and burn out your lungs 5 times. They won't come back. They're going to quit. So when I'm teaching my learners, I want my learners to want to come to me and want to learn from me. So I really need to make sure I know where they're at and know how to shape up what I want to shape. Hillary, can you give me sharing power for 1 second so I can show a data sheet?
Yeah. You just have to give it back to me when you're done.
I will give you back the power. Okay. Okay, can you guys see this data sheet?
Yep.
Cool. So when we're talking about shaping, I do think it's an art, especially when you love the game of SBT and your learner loves the game of SBT. It does become this art-like kind of thing. So sorry about this. I made this today because I just couldn't find a good data sheet to take a picture of that I'd feel comfortable with. But it is breaking those skills down and then looking at the performance-based tier. So in this example, I have say this kid has an iPad. My first SD might be paused, the iPad. I'm going through Cab 1A. As soon as they make that little pointer to go towards that iPad, I might be like, sure. And if you see here, why did I make this decision to break it down? So I had a Cab 1, then I tried to prompt R2 on my first one. I had another R2. I'm getting an R2 here. I'm getting an R2 here. In my brain, I don't know why the next trial in Cab 1, I think wouldn't get an R2. I'm starting to think I need to break this down even more. So I start to break it down by using this Cab 1, Cab B, Cab C. So my Cab 1B might be the pointer finger is like a centimeter away from that iPad. So I can be the cool guy that's like, oh, you don't actually need to pause it. I just want to get a little bit closer to it. So as soon as I get successful trials on 1A and 1B, I start to vary 1A and 1B. So it's unpredictable and intermittent when this is and then my Cab 1C maybe are going to pause it. But right here on one of them, I have an R2. So I'm like, okay, I got an R2. I'm going to do a Cab 1B. So Ed has an awesome saying, don't become a prisoner of the data sheet. And that is so true because it can go so wrong where it's like, well, it's telling me to do this. It's telling me to do this. And then you kind of get stuck in that funk. And you are just getting a lot of R2s happening that can lead to R1s and your learn is just not progressing. So remember, this is a performance-based process. So as soon as I got this Cab 1, A, and B, I want to make sure that it's for SBT purposes. I'm not saying, okay, got Cab 1 A, now I'm only going to do cab 1B. I'm actually going to put cab 1A back in there so the learner still has that predictability. And then once the kiddo does pause the iPad, my next SD changes to hand me the iPad. So these would be maybe how I would break that down, puts 2 hands on it, starts to pick it up. And then same thing here is that, okay, usually what I do, and this is just me, so it's not researched or anything, as soon as they get to the pause, I might use cab 1A, cab 1B shorty if once I'm starting this one, but so cab 1D and cab 1C are the 2 I might have in play doing this. So you really are analyzing every little thing. But I think the important thing is look at that performance based, how they're doing, and break it down. Because I could probably break this cab 1B down to even smaller. Because usually what happens with those iPads are you push pause and pause really doesn't happen. You got to push it like 5 times, and your learner becomes frustrated. So it's like maybe after the second time. So you can really break this down. And when I was talking to Ed and Hiller yesterday, this process, I think it can go fast, but this can take 4 weeks for me to get through this cab 1, depending on my learner and how far I have to break this down for them. And if I'm seeing R2s in here, maybe it's because of the cab 1, or maybe because my HRE isn't good enough, or maybe it's because my EO I said was too hot. Maybe I need if I'm doing 2 branches, I need to go veer to that other branch, because that other branch maybe isn't too hot and I can gain a little bit more trust and then go back to that hot branch. So I will stop my share and give you power back, Hillary. All right, you have the power, I think.
Thanks.
Can I jump in real quick to Hillary?
Yeah, I have some thoughts too, but go ahead.
Okay, thank you. Before Shane, that was awesome, the data sheet. Thank you, Shane. That was I think that was a good visual for people to see. And I agree. And then even going off of that data sheet, I can say too that you know, you can, like you said, you can break it down even more, you know, to the but you also might find, say, when you start breaking these down, that after they get to 1A, B, C, and you might have like an entire alphabet that you think you're going to have to do because it was so hard at the very beginning. They might pick up on that trust already, or they might start building where you don't have to break it down as you go. So it's like definitely important to, throughout the process, to keep checking in to making sure that you know, that you are where you're supposed to be, basically. You know what I mean? So sometimes you don't have to shape as much as you did in the beginning. And also you find, I think, in different branches that, you know, if you had tried, you know, branch C as branch A, maybe it would have been a lot harder, but because they've already had A and B, they're kind of locked in with you as it is. So that was a good point as far as, you know, switching back and forth too. You know, I was looking at the 1, 2, 3 right here, and, you know, it just popped in my brain too that we're talking about the SR and having the right amount of it to match what's really hard. You know, this process itself is shaping, you know, like, and not just like the more nitty gritty shaping that we're talking about, but what is, you know, the skill-based treatment when you have a branch? It's, you know, it's starting off with communicating, and then you're shaping, relinquishing, transitioning, and then going to do whatever they're doing, like that thing that they're doing, right? So when I'm looking at this, is number 3 is the canvas. If, you know, this big skill that they're going to have, this big canvas, you need enough of number 1, you need enough of the paint, right? So you need enough of that SR, you need enough of the HRE. And then what brushes you use to it, you know, you might only need 3 brushes to get all the paint on there, or you might need 100, you know, it depends on, again, the learner, and also, you know, how hot it is, how hard the skill is. So that's just the thought that popped in my head was, you know, just that you need enough for the canvas, basically. That's the idea. And I have an anecdote of, you know, recently I have a student who he has a really difficult time with transitioning, with relinquishing. I know many students do, but like his thing is that he, you know, once he gets even just past the relinquishing of his thing, he'll go and do everything. But, you know, that initial step is really hard. It's going to prevent him from doing a lot of things in life. Like, he has a lot of good skills, and, you know, so we've been working on it in practice. Now that we're at Cab 2, when I tell him that it's all done, he presses pause, hands it, no problem, whatever he's doing. and is quiet, then he actually folds his hands. If I'm telling you 100% of the time, maybe 99%, 100% of the time outside of practice, if you say, okay, pal, that's all done, he repeats it back to you in a high pitched voice, that's all done. He doesn't do that in practice. So again, it's that trust that's being built, but also, that's his hardest skill. That like Cab 1 is going to be his biggest thing. And we're already at that point. I think it's because of what we were talking about before. So,
I have a couple thoughts. One, when Shane was talking about the SR condition, one thing I try to tell people frequently is pay attention to attention. And I think this is something I forgot a little bit of early in this process, was how important it is what kind of attention your learner is looking for. So really paying attention to that. I'm gonna do a little shameless plug here. And Dr. Miller's on, I just recorded a podcast with her and it was released today about RIE parenting. And what I love about RIE parenting, and if you don't know anything about it, I highly encourage you to look into it, is it really actually will teach you how to do an SR condition with the attention component. So definitely, you don't have to listen to my podcast. It's like another 2 hours of me talking. Listen to it, it's really good. But if nothing else, check out RIE parenting, because it really helps you understand what Shane was talking about, which is like being in a space with a student or a learner and joining them in that space in a way that's meaningful to them. And I think that's just the most valuable thing that we can do for children in general, let alone our population who don't typically have people doing that for them in their lives. I also love Shane. I think this is something that I frequently talk about when I'm chatting with people about this process is, I'm going to come back to Alicia's message too. Don't be a slave to the data sheet or your shaping steps. Change them when you need to, and never forget to sometimes reinforce those early steps. So even if you've had Cab 1 mastered for 6 months, sometimes you should still give that shorty of the reach to point should be reinforced, because it is important sometimes for that learner to think, oh, maybe if I just reach, I'll get reinforced. And let your learner teach you, right? Like, so if like Shane was just demonstrating so beautifully with that data sheet, you're getting R2, 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 your learner's telling you that this is too much, right? Like whatever you're doing right now is not effective, even if you're doing what Alicia said, which is prompting them through it and working through it with them. And it's continuing across many trials, your learner's telling you something, right? And then returning to Alicia's comment, this is such an important thing, and I highly encourage anyone to go listen to our hangout with Dr. Rajaraman about this, which is how to push through a shaping step. So if you're getting an R2, how to push through to the next appropriate response or some similar response, and let your learner teach you what you need to do next. So if that happens, like Alicia said, and I've had this happen to me frequently too, you push through, you're providing a lot of reassurance, you're right there with your learner, you're with them, it's hard for them, and you do it. And maybe on the next trial, it's still a little bit hard. And then after that, it's smooth sailing. Sweet. Now you know that when you get those low level R2s, if you push through a little bit and you are there with them, things are going to be okay. However, if you're in Shane's position and you go and you push through once, you push through twice, you push through three times, what does Cooper tell us? 3 data points for a trend, right? So at that point, you might need to say, this is not working, I need to change my shaping step. And I think what I love so much is that, yes, is this a curriculum and like a guide that we should follow? Absolutely, but there's so much flexibility in there. Cab 1 relinquishing can look so many different ways. I was telling Shane and Ed about a learner I have who will be on like legitimately 40 to 50 devices at one time, and they're all playing, and relinquishing and pausing them took us weeks, because we had for every single device had to reinforce a reach, a touch, a pause, a transition, a reach, a touch, a pause, a transition. It took us forever. But now, all right, buddy, let's go do work. Ding, ding, everything's paused in 5 seconds. We no longer have to do those micro shaping steps. We still variably and unpredictably reinforce them. But it was so worth it to spend the time shaping the heck out of that spot, because that was where, similar to Ed's client, that was where the problem behavior lived, was once my devices are gone, they're gone. And I'm so anxious about that, that if we spent the time there, we were able to move forward in such a meaningful way. So I don't know, that was just a ramble of all the thoughts that I was having as everyone was talking. So.
Cool.
All right.
No, and
Next.
I think the last thing
Shane.
I have to touch on, I'm gonna touch on one more thing about Alicia's comment about reassurance. I think we're behavior analysts, we should consistently be analyzing, and that is something that always communicating with your learner, like letting them know, like if they're having an R2, just like you do with anybody else, And trying to be relaxed about it, like, oh, this is going to be okay. Like, we're going to get through this together. Like, even those little things I have seen just be so helpful for the learner. And those are televisable, where it's like, I am coaching you through this. So yeah, that's all I have for this slide.
Acknowledge, empathize, and be there. Be in the moment, right? We don't need to fix that you're upset. We can acknowledge and empathize with you around how you're feeling, and that is an okay place to be. And I will be there with you, and I'm not going to leave you there alone. I think that is just such a beautiful thing that we can do, not only for the people that we work with, but just like for anyone in our entire lives, but especially children, right? Like that's a really important thing and an important place to be with people.
I agree, and you can go to the next slide, but I'll just kind of like segue. I think also in that point, that's where the analysis comes in also. Like, if they are having a difficult time on trial 1, 2, and 3 on it, those aren't like, it's not a failure. It's not, don't be disappointed, analyze it. Like that's teaching you something right there too. So it's just really important to constantly, and that we've had a discussion yesterday about this, where, ideally you would be with your client 100% of the time for 100% of the trials. But the idea of when you're running sessions and you need that feedback of how these trials are going on from trial to trial. So, definitely early on, and then for as long as possible, being as involved, whether it's ideally sitting in the session and being able to watch all of it, or through video or through Zoom, whatever it has to be. This isn't really something where you can say, okay, here's the data sheet, and you go, you tell whoever it is, okay, you have 2 hours, you go do it, and then let me know how it goes, kind of thing. Like, I mean, that does happen, but it's not ideal, and it's because of that trial by trial decision making that you need to be making. And I can tell you, like, just from experience, what I've seen is, and this is actually an example, you can watch video of someone who's pretty experienced doing it, and then give them feedback afterwards, right? So that they are prepared for the next session. But then in that next session, if there's been 1 or 2 or 3 trials where, like, if you were there, you'd be giving them additional feedback. Now they have an entire session where you would wish you could have been there to be part of it. So, ideally, you're going to be, especially early on, be very involved in the shaping process, because it's an art form. You're not just throwing paint against the canvas. It's progressing. It's you're calculating things. You're just doing trial by trial analysis. So, okay, that's it for me.
I forgot to do this on the last slide, but this is being recorded. So if your video is on and you are speaking, you're consenting to being on a recording that is going to be put up on YouTube. So before I go into too much on this slide, I kind of have a request of the community, if you want to put it in the chat, about how specific you want like put a yes if you want me to go pretty detailed in examples of how to shape within cabs. And a no, and don't say anything if you don't want me to, because it's going to be a lot of scrolling if there's a lot. So yes, if you want extra details, and nothing if you just want a general overview. Okay, here we go.
Mm-hmm. And also the next slide too is is a spot to give examples too. So yeah, if we go deep on this one, then that's okay, because it'll be basically the same thing on the next slide. So
okay, great. Before I jump into this, I want to jump off of something Ed was talking about, and there's not really an appropriate time to have this discussion, right? Like, is it generalization? Is it shaping? Is it SR? How do you manage teaching these skills when you are teaching other people to teach them, right? So I think this is such an important lesson for us as behavior analysts, or not, even not as a behavior analyst, maybe someone who's really familiar with this process, has a lot of practice shaping. When you're teaching other people how to shape, this is a skill that we have to be able to do it with our learners. So in our discussion yesterday, this was like a 15-minute diversion, but I think it's just really important for us to remember that these early skills, especially for me personally, what I have found is usually through CAB 3, these early shaping and micro shaping and breaking down of shaping steps are best done with someone who is very familiar with the process, who knows how to shape really well. And so I think what we can run into sometimes when we're doing this is we can outline a beautiful A through Z shaping plan, right? Like, I want you to first reinforce this, and 26 steps, and tell someone to do it. It's something entirely different for someone to actually do that on their own without guidance. So thanks, Greg, for that resource. I just want to reiterate that like, it is it is very important that if it's not yourself, or if it's not someone who's incredibly good at this process, or even if you're learning it, but you have the prerequisite skills to apply, you know how to shape, and now you're learning how to shape within SBT, this can be really difficult to just hand to someone and have them do on their own. I think Ed touched on this a little bit, is you might be there, you might teach them a couple things, and you leave and you come back 6 treatment hours later, and then there's some stuff going on that maybe you have to fix, and that can be sometimes troublesome for your learner. So I don't know the answer always, but for me personally, within my practice, I have a lot of really amazing clinicians working with me. Many of them are on this call. Hi guys. Who can generally do a lot of these early steps on their own because they've done it a lot with me, and we've taught them that skill. But when it's someone new and someone I haven't trained, or it's a new client with a significant level of complexity, even with my most trained and veteran staff, I'm oftentimes at 80 to 90%, if not 100% of the sessions, until we get things, ripping and roaring up the mountain. So that's just a little disclaimer. Okay, so let's talk about actual shaping within this stuff. I can't even see the slide, so I'm just going to talk. I know, let's talk. I have so many windows up on my screen. So let's talk about FCR. So when we're talking about communication, how we can shape within shaping. So oftentimes I'm talking in the group, we hear like, and actually there was a recent question about this. So if we have a simple FCR, how can I complexify it? I don't know if that's a word. Make it complex with a learner who has, minimal language skills, who is on PECS level 1, or who, really struggles with sign language, who has a very limited communication repertoire. So the first thing I like to do when I'm thinking about how to shape my FCR is make a couple of decisions about it. Am I looking for a verbal response, a gesture response, or some kind of like handing PEC complexify? It's a word, I made it, or a lanyard. Like what am I choosing for my communication? Once I choose that, I generally make a decision pretty quickly if that learner needs us to do a complex FCR, or if we should just stick with something that is efficient and working for them, and then move to the meat of treatment. So very frequently I work, generally my population is mod severe. So very frequently I'm working with learners who have very limited communication repertoires. And so we're choosing one FCR and we're going to stick with it. We're not going to complexify it, and we might even skip our TR. So when I choose that, there's not a lot of shaping, or maybe there is, right? Maybe I do have to teach a brand new gesture, and my shaping is initially having them hand me something when I put my hand out. So I say, okay, buddy, it's time to be done. And I put out my hand, and then they hand me something, and I'm shaping that to, okay, buddy, it's time to be done. And them initiating, handing me something, right? Like there is a shaping process in that, because in essence, by putting my hand out, I am prompting my learner to communicate the FCR. And I want the heat of my EO to cause the FCR to happen. And so I might have to shape that a little bit to teach them, when it feels hot, that's when you should do the thing. So we might have to shape that. We might have to, I oftentimes will use a time delay prompt before I put my hand out, and maybe turn up the heat a little bit too, depending on my learner. So, okay, but it's time to be all done. Count in my head, usually to 5, because I count really fast, just like I talk really fast. 1, 2, 3, 4, 5. All right, stand up. 1, 2, 3, 4, 5. Then I might put my hand out, right? So, and I'm gonna vary that as I go to try to get them to initiate that FCR. If I'm using verbal communication, maybe we start with my way, and then we shape it up to can I have my way, please? And maybe I'll add the excuse me, and maybe I won't. A really common question in the group is, how do we shape the excuse me pause, or the bid for attention plus a pause? Then can I have my way, please? Whether that's with language or gestures or PECs. That's all shaping. How can we shape that? So you can choose a variety of modalities to do this. You can backward chain it, you could forward chain it, you could do some extra stimuli put in there. So for example, you might have an excuse me, whether that's with a verbal communication or a gesture, and then teach them something to do for the pause. So excuse me, and then teach them to like put their hands in their lap, or a tap, put their hands in their lap, and then pause. Can I have my way, please? All of those are micro steps of shaping that you have to learn how to teach your learner, and let them teach you how to teach them to do it. Does that make sense? Right? So you might choose a step put their hands in their lap and it's not working, and you go 3 to maybe 10 trials and it's just not taking, you're going to change your approach and try something else. And maybe after a while, you might have to drop it. You might have to say, right now, it's not worth spending 7 sessions on teaching excuse me when we could have spent those 7 sessions shaping cab 1. And I think that's a really important decision to make when you're in those positions. Like, what is the meat of our treatment? Is our treatment teaching a learner to bid for attention appropriately? Maybe. It might be, that might be the thing that we need to shape. Or is our treatment targeting relinquishing reinforcement and moving on to meaningful skills? The excuse me might be a meaningful skill. So that's only a decision you can make knowing your learner. The TR is not on here, but the TR is the same. You might start teaching the TR and find that it's a non-starter, right? Ed has a great presentation about this. When they were doing the TR, they ended up having to skip it and come back to it as a cab 6 because it was too hot to handle. I have a lot of clients where the language acquisition piece of a TR, just discriminating between an EO and a denial, becomes so confusing and convoluted that we end up just doing TR to our cab 1. No, not right now, put your hands down. And then we just move on. Maybe we don't even issue the denial at first, like Ed's example in his, I don't know which presentation that was, Ed.
I think it was the Learn While Teaching, but also covered in Autism New Jersey too.
Yeah. Great example of dropping the TR and coming back to it later because the word no was just too hot. So these are all considerations to make, and it might be worth trying to shape it, and it might not be worth trying to shape it. So those are decisions that you have to make. So cab 1, relinquish. One of the things I like to think about is we oftentimes think about, and Penny made this comment earlier, we oftentimes think about the SR condition being things, like being reinforcers, but it's truly, like Shane said, a context. And oftentimes we might be doing this programming across multiple contexts. So if you're teaching your cab 1 A through D is to relinquish the iPad, but then tomorrow your learner comes in and they want to play on the trampoline without the iPad, you might have to start over with your shaping steps, and that is a generalization context. You're now treating a new context for relinquishing. And if you're early in the process, you might have to start over from square one at cab 1A and shape it down, shape the heck out of it again. So for me, this is where it becomes really tricky if I'm training new people to run this process and I'm teaching them how to shape relinquishing the iPad, and they're maybe really new to SBT, and then the next time they come into session, the learner is playing in water at the sink, feeding or making food, right? That's when it becomes tricky if you're not sure how to start shaping, and it's really important that we're there to teach people how to do this, that now instead of relinquishing is not pause the iPad anymore. It's, for me, I oftentimes try to train people to think of one direction, any direction. And if we're having to micro shape it, think about initiating, the middle of it, and the completion of that direction. And if we're micro shaping and I'm not there and a new context pops up, think about how you can reinforce the initiation of the direction, some part of following the direction, and the completion of the direction. And if that's your only thing that you shape for the day, that's okay, especially if it's a new context, because you're truly treating a generalization context. Then cab 1B, or the next step, would be the second direction. So maybe it's your first step is turn off the water if they're playing in the sink in a new context, for example, and you haven't targeted it before. You're going to say, okay, turn off the water, or hey, touch the sink. And they're going to reach to touch the sink, and you're going to say, oh, you can have your way, we're done. And then you're going to say, okay, touch it, you can have your way. And then you're going to say, turn it off, you can have your way. That's your micro shaping for that new context of turning off the water to begin relinquishing playing in the sink, or whatever it is. And then you might have a second direction, which is, put the towel over there. They reach for the towel, you reinforce that. They touch the towel, you reinforce that. They move the towel, you reinforce that. They put their hands back to the sink, you reinforce that. And through that, you're still going to reinforce all of those steps. Sometimes the reach for the sink, sometimes the turning off of the sink, sometimes the putting of the towel. And then then you might have a third direction, right? So think of it as like 1, 2, 3, 4 directions. If you're treating across a multitude of contexts for relinquishing, same thing for transitioning. 1, 2, 3, 4 directions. And if you're not sure where they're going to be or what they're going to be doing within those 4 directions, here are the types of things you can reinforce. Initiation of a direction, following of a direction, doing the direction, completing the direction. Cab 2 is similar, right? So I have learners who want to walk. I love the video from Upstate where they have a learner on a walk. I think that is so relatable to the context that I oftentimes run into, where we get to Cab 2 and we've been hanging out in the clinic or in their bedroom, and all of a sudden we're, like Alicia says, we're on the trampoline. And we've treated Cab 2 transitions from the bedroom to the, you know, kitchen table or wherever we're going, but now we're in a whole new context again and we have to reshape. So if I have learners who are going to be in various contexts, I oftentimes design my cabs to be applicable across contexts so that my staff don't get too stuck thinking these are the directions I have to follow to do this cab. So for Cab 2, I might say stand up or one step, and then Cab 2B is, you know, 1/4 of the total distance to travel. And then it's 1/2 of the total distance to travel, or whatever it is. I just try to make it as flexible as possible. And again, it's, you can reinforce at the halfway point, just before the halfway point, just after the halfway point, anytime in between the halfway and the 3/4 of the way. Like, make sure you're really flexible when and where you're reinforcing those things. And if you're out on a walk and it's too far to come back, we might have to change our context completely to bring the work with us and find a picnic table nearby, just like in the video that we saw from UCP. Yeah, okay, so in the shape, I keep looking at the slide and seeing pieces of it. I just keep seeing can always be broken down smaller. It can always be broken down smaller. Like, you could have a Cab 1 that has 27 steps, and I in fact have done this. And then you can shape it into larger steps over time, but you might have to break it down that small at first in order to get success with your learner.
Wait, can I say something real quick too?
Yeah, please.
I'll give you a breath. Take a breath. So, you know, I'm looking at as going down. So FCR, Cab 1, Cab 2, and then the Cab branches. I'm thinking about the evolution of what the data sheets have looked like too, from at least from the earlier ones that I had seen. And I think that oftentimes Cab 1 and Cab 2 are the areas for shaping that people kind of either get stuck on or have like a lot of questions on, because, you know, built into the FCR, even like on the data sheets, it's like the S, the I, and the C, right? So the simple, improving, and more complex, or complexify, whatever you had said before. Then for the Cab branches, they used to be like easy, medium, hard. So like even in those steps, it was always like, okay, well, you're shaping to get these. But Cab 1 and Cab 2, it was like, you know, relinquish. Oh, they just give it up. So, you know, it's breaking from that like mold. And, you know, I think that it's more commonly, you know, known now that like that you might have to, and if you have to, then you should, you know, break these down. I love the idea of the transitioning to the steps away, you know, like measuring it that way. It's stuff that, you know, we've done the same thing, like, you know, walking away from the playground, walking past the walking past the pool, this kind of stuff. It's ways of, you know, dealing with these really hot EOs that, you know, there's always been shaping that we could have done, but it's like we didn't think of doing that, you know, until seeing this process. So that's been pretty cool also. And then the last thing I was thinking of between Cab 1 and Cab 2, and that's escaping me. Oh, I know. We had a discussion yesterday about this. And the other thing is, especially for these 2 steps, don't get hung up on, oh, is this the right kind of Cab 1, or is this Cab 2? Or, you know, sometimes these are like really close together, and they're almost like a real package deal. Even with the throwing the TR, like, you know, if your student is doing a TR, say they're folding their hands and the iPad's on the table, and they say, "Can I have my way?" And you say, "No, not right now." And they do the TR, you know, they start to fold their hands. Well, they're kind of relinquishing the iPad at that point too, right? You know, for some students, you know, we've actually, you know, even like the pause and like the look away type thing, right? Or look towards you. That's relinquishing. Whereas the TR is them saying like, okay, it's like kind of all blends together, especially too when you're out in, you know, the really natural environment, you're moving around. Sometimes these things sometimes a student might have to relinquish to then go use their FCR. Say they're using a device and they're playing with something. It's like, hey, you have to be all done with that. Well, they have to jump off the trampoline to go over and communicate to you. Well, they already relinquished at that point. So I've just seen sometimes posts where people are questioning or wondering if they're doing it the right way. The whole goal is for them to give up the stuff they're doing, to be able to transition to the things that they maybe don't want to do the most, trust you in doing it, and communicate while doing it. Like, it might not always follow this pattern right here. Oftentimes it does, but doesn't have to.
Absolutely. And I think another big thing is like, we don't have to clean up everything. I mean, relinquishing can be just putting down what's in your hands. Like I was talking to someone the other day who has a client who has their whole train set up. Like I play trains with my son and we spend hours designing train tracks. I would never want to have to clean that up before asking him to transition away. Like we put so much time and energy into it. Instead, and I've done this with my son, instead what we do is everything is set up and we have a place to put the things that we're currently working on so that our little sister doesn't mess them up. And we set them there, and that's our relinquishing, is we have a train and a track and a plan. And our plan is stopped. The track is set in the box, the trains are set in the box, and maybe even a couple other things because other kids are in the house. So maybe we have to put a couple things away in the moment so that no one else plays with them. And then we walk away, right? So we're not cleaning up all the tracks. We're not ending YouTube. We're not like, those things they're just paused, right? They're just paused for the moment. We don't have to clean up the whole puzzle. Maybe we just have to put the pieces we're currently working on down, right? So I think that's really an important part of relinquishing, is we're not asking someone to sanitize their environment. We might, because it depends. We might have to do that, right? There is probably a case where you have to put all the things away or have a more sanitized environment. You have to be really creative about that. But that's just, I just want to think like, what is real life? In my house, real life is we leave the train tracks out and we come back to them when it's time to come back to them. There's a question about any tips for relinquishing, pausing open-ended, unpausable online games.
Ooh, Minecraft.
Shane, I feel like you have
Hillary,
experience with this. Oh, but you're gonna walk away.
No, real quick, before I can try to answer that one, might not have the answer, but I think something you said in the beginning is really important, and then Ed touched on it, is your cab 1 and your cab 2 might not always look the same. So really it's teaching obviously the best you can, but teaching people how to shape in general, because you don't want the process to stop if they choose to go on the trampoline, where it's like, well, if they're on the trampoline, this doesn't count. We're not gonna like do it because that's not their HRE, when really it's like, oh, their HRE just moved over there. So teaching people how to shape and teaching them how to, really be in that process and just like on their own. Like I said, I hope I don't sound like a bad behavior analyst, but I will tell my RBT sometimes, like, just write it down if it's not on the data sheet. Like, you might not be able to circle something or do this, but I'd rather you do the right thing than nothing or the wrong thing because like it told you to do it. Just shape it and we can go over it, or if you have a camera, we have consent, film it, and then we can go over it if I'm not there. So I think that's an important one. Yes, unpausable games. So I have some high schoolers that love these unpausable games. Minecraft, some of them are pausable, like Madden. Well, if they're playing online against somebody, that's always can be a struggle. So really, I go back to how HRE are they into when they're playing these games, because sometimes those games can get pretty stressful in the moment. So it's really paying attention when it's not stressful. A tactic I like to use all the time, if a kiddo's playing Minecraft, especially so I'll try to give a learner profile, a kiddo who maybe they're in high school, they have a lot of vocals, they're very complex with their vocabulary, they're very socially aware. Those type of kiddos, if they're playing Minecraft, I don't like to just like sit behind them and like be like, oh, I'm just like watching what you're doing. I will comment, or sometimes I'll just, even if I don't know how to play, I'll download Minecraft on my device and try to play it myself. And then I'll be kind of keeping an eye on them of when it's maybe a reasonable time to walk away. Another thing I've done as well is, if the learner, and this depends, right? You can just like anybody else, talk to them. I will tell them, hey, this is what we're doing today. I may have to ask you to, if this is like what we're going to be hanging out doing, I may have to ask you to pause it during this Minecraft or during this live game. But this is what we're going to do. Are there any spots in this game that are better to like let me to actually like for me to present this EO to you than not? So that doesn't always work, but for some kiddos they have been like, well, at least you told me you're gonna like ruin this game for me, thanks. And then I can figure out a way to pause the game. But it can be hard, but also it's I know we don't like to add anything into the HRE, but that might be a time where I'm like, you know, maybe I'll put a game that I know I can pause on one of my devices. So I have an iPad I'll bring, so I might bring a game that I can pause just to be like, oh, that learner might pique their interest and be like, oh yeah, this is a game we can do together. So it's getting creative as well, in my experience. Yep.
Okay. The last thing we're going to talk about for shaping is the cab branches. And I like talking about this in terms of responding, like number of responses, which is a really standard way to discuss this, and time units of cooperation, or as Dr. Rajaraman coined it, tucks. So it's the same for me. If we're doing number of responses, I'm oftentimes teaching people, I don't know if am I cutting out? Shane and Ed are both like they're the only two people I can see.
I can hear you. I can hear you.
Okay. If we can choose the right, so I think what's important, we're thinking about responses, number of responses, like what are we actually calling a response is the first thing I want to figure out. Are we saying a response is reading a sentence or reading a word? And if we can decide that, then we can decide how to shape. So if our goal is a response is reading a sentence, then we might need to start with shaping reading a word, for example, or like doing a whole math problem might just be doing part of the math problem. So when I'm thinking about responses, again, I come back to initiation of the task, completion of the task, or engagement with the task and completion of the task as like three things I might micro shape. I don't know if anyone can hear me. Everyone is completely frozen. So then
I can still hear you.
Okay, cool, thanks. And then time units of cooperation, I oftentimes my cab, so like sometimes this might not need relinquishment or transition. So even if that's the case, this would look the same. But for time units of cooperation, for me personally, I usually do my initial cab 3A is 1 to 10 seconds of engagement with a specific activity, and we outline what that engagement looks like. And then cab B would be 10 to 15, and cab C is 15 to 30, for example. And then what I teach people to do is you're not just reinforcing 30 seconds of appropriate engagement with an activity or cooperation with activity. You're actually going to reinforce anything within 30 seconds. It can be 5 seconds. When you're doing a cab 1C, for example, and it says 15 to 30 seconds, you could reinforce 16 seconds or 29 seconds or 25 seconds. It does not matter. That's how you're going to shape up the time units of cooperation throughout time with me personally. And what we have to do when we do this is really decide what time units of cooperation looks like for that cab. So if it is to play or to play alone, what does to play alone actually mean, right? So it's not just a DRO. It's not just anything but engaging in problem behavior. It's actually the activity you want them to be doing. So is it full engagement with a puzzle, even if they're not doing it correctly, but like attempting, or what kind of effort do we want them to be giving? These are the things that we want to be reinforcing. And then when you reinforce, you want to reinforce at the best effort, right? Not 30 seconds, but at the best effort for that part of the chain that you're in. So if it's 15 to 30 seconds and at seconds, and we're not like watching a timer or anything, but if you've done this long enough, when a minute is a minute. So if we're saying it's 30 seconds and it's like maybe 15 seconds in and they're doing okay, but they're lollygagging a little bit. But then at second 20, they're giving a lot of energy into the activity. That's when you want to reinforce, because that's going to teach them, oh, when I'm giving my best effort, I'm more likely to get my way. And that's how you can shape up over time. Yeah, do you guys have anything to add for the branches specifically?
No, the only thing I would add as far as, do you want to go to the next slide actually? Because then,
yeah.
So as far as the branches, I would say this is probably other than like the FCR, TR part, actually I like shaping all of them, but I love shaping within like the 3 through 6 part of the branches. I think that, again, it's like one of those eye-opening part of the process that, you know, it seems to me now that prior to using this process, it was like trying to, you know, teach with like one hand tied behind your back kind of thing. Like you weren't using all the tools, even though like I had known like what shaping was and I would use it for certain things. The idea of combining with the intermittent unpredictable reinforcement and, you know, breaking some of the stuff down like that I just hadn't really considered before. It's just been so eye-opening. So let's see, so I was going to talk about, not academics, so not leisure either. So we have a few students who have a hard time in, say, like fitness class or stuff that's like out and moving. So I like to use this example because, you know, I think a lot of people are familiar with being able to measure, you know, responses, you know, if you're doing cards at a table, or if you're going to be using time, so using the tucks. But sometimes it can get a little more, not dicey, but it can be maybe a little more ambiguous when you're out in the move. You know, like, you know, your transition to, if it's a fitness circuit and a student has had a long history of, say, not wanting to participate in them, you know, the class is always on their circuits and the gym teachers leading the exercises. You know, they transition to that spot on like the little circle. But are you then measuring once they're transitioned there? Are you measuring like how many times that they touch their toes for the measuring through? Are you measuring how long they're participating while they're over there? I think that, again, this depends, and sometimes for some of our guys, it does look like you're trying to get them when they're doing their best, because sometimes they also need prompting, and then prompting can be an issue as far as, you know, part of their Cap 6 challenges. So this is, I think that when you get out into, when you're moving around, you always have to make sure that you're staying in that performance-based, you know, analyzing what. So it's not, they're not leading anymore. So they're not leading their SR and you're following that way, but they're still leading, you're still watching their performance and basing decisions within the trial on that. Especially when you get into like the more ambiguous, you know, you could say, like I said, you know, 3 exercises, but not all exercises are built the same, right? You could say, you know, walking on the treadmill for, you know, 5 minutes, but again, you know, depending on the speed, depending on how they're doing that day, depending on other things that are going on in the fitness room that day, you know, sometimes one of the EOs for some of the students might be pure noise or something that a peer is watching. So you always want to be mindful of this. And if that means taking a step back too, like if they're having a tough time that day, then maybe you're going to just be shaping a little more on just getting on the treadmill. Or you're going to be shaping, you know, picking up the ball, getting ready to throw it. Whereas the day before they had been throwing it 10 times. So make sure you keep that performance-based mindset, you know, throughout the branch, basically.
Yes.
What I want to throw in.
Absolutely. I couldn't agree more. And I don't have anything to add. I'm sure I do. That was great.
No, I think the main point too you made is that keep analyzing. Like if it's not going the way you want it to go, you're seeing those R2s or R1s, keep analyzing, because you always find success in something if you are shaping these things.
Yep.
No, am I frozen?
No, now I can hear you.
Well, can you guys hear me? Okay, you guys can hear all. Okay.
I'm back.
Good. So I'm going to be hopping off now too. So I'm glad you guys are back.
That's great.
I'm not abandoning.
This is the end. So I'm going to stop sharing. I'm going to end the recording, and I don't know. I'm open to staying on for anybody who has any questions they want to ask. But I'm going to stop our recording.